2,
Do I even
feel like
4,
having
5.
breakfast? Should I go back to sleep? Am I even hungry? I don't feel that hungry. I might be. Why do these grapes look like this? Should I eat them? Maybe they're bad. What if they're bad? Am I even hungry? I don't feel that hungry. They're not gonna fit. Move them over. They're not gonna fit. Move them over. Move them over. Move them over. A little more. 1, 2, 3, 4, 5. They're so green. 1. How are they so green? 3. Just chew. 4. 5 times on each side. Wash the plate. Check 1, the stove. 2. Wash 3, plate. 4, 5. Wash plate. I never used the stove. I'll check it just to be sure. 1 should be off. 2. Why would it be on if I never used it? 5. Okay. You're going to be late for work. Get dressed. Do I have to go to work today? Is there work today? It's Monday. Why not Bell Saturday? Bell. There is work today. I'm sure. Bell. I should check my calendar. There probably is work today. Socks. There is. Pants, Bell. Is there? What if there isn't? That would make me look dumb. Don't step on the cracks. Avoid the cracks. Close the door. 1. Lock the door. 2. Lock the door. 3, 4, 5. The door is locked. Is it? Check. Lock the door. I locked it. Didn't I? One more time won't hurt. I don't know. I'm going to be late. The door is locked. Check the door. Go back. Go back. Go back. Lock it properly. The door is locked. Is it? Go back. Check it again. Go back. One more time. One more time. One more time. I locked it. Again. Again. Go back. Again. 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 I locked it. Okay. 1, 2, 3, 4, 5.
Okay.
It is morning.
I don't.
How is it already morning? How many hours was I sleeping?
Should I exit? Yeah. Okay. So that just showed like how much is going on in someone's brain that has OCD. And it's a common anxiety disorder, and it's when a person has uncontrollable reoccurring thoughts, which are obsessions, and then behaviors which are compulsions that he or she feels the urge to repeat over and over again. The DSM-5 criteria is it's considered OCD if your obsessions and compulsions take up a lot of time, so like usually it's an hour or more a day, and if they cause distress or problems in social situations such as like school or your job or other important aspects, and also if the symptoms aren't the effects of substance use or abuse. Warning signs, if they're resisting change, spending too much time or redoing tasks, excessive washing of your hands or your body, interested in numeric patterns, or experiencing outbursts when you're unable to complete something a certain way. Then obsessive symptoms, it's fear of contamination, being ill or harming yourself or another, need for symmetry or order, religious fears, and taboo thoughts. Then compulsive systems is repeatedly checking or counting things, like when he repeatedly had to go lock the door, and doing things a specific way or a specific number of times, and then excessive interest in routines, rituals, and patterns.
Okay, so some of the causes is that they can be genetic and hereditary, which is a possibility, but the main things they found is that there's a chemical, structural, and functional abnormalities in the brain, and they have a psychoanalytical approach where they see that the different factors come together which cause OCD, so there's not like one main thing, but it is in the brain. So the drug therapy, the first drug we have is clomipramine, which helps decrease the obsessions and reduces the urge to do the compulsions. One bad thing it can do though is it can cause severe mood changes and can have ringing in the ears. The second one is fluoxetine, which 47% of patients feel better after taking it for 13 weeks, but they can get really easy bruising and bleeding, and their vision changes severely at night. The third one is sertraline, which decreases the unwanted thoughts in their mind to redo their task and to reduce the compulsions that they have. Bad thing about it is that it can cause muscle cramps and nausea. So behavior therapy, we can look at Ivan Pavlov with his experiment with the dogs and how they learned how to salivate when the bell rang. But we would take the exposure therapy approach where you put the patients in the OCD or the situations that cause their OCD. So it's like classical conditioning. So over time, it will reduce their compulsions and avoid that behavior, and it allows the person to like rebuild trust in their mind, in their management, and their functioning. Development is there's a new study where they compare people with brains with OCD and people without, and there was like thousands of people, and the main thing they found was in the cortex and the parietal lobe. The surface areas were smaller and they were a lot thinner because the cortex controls like the functions, memories, thoughts, cognition, and emotion of your mind, and so that's like where the part where OCD is. Some of the stats we have is that it affects 1 in 40 adults, 1 in 100 children, and those combined is 2.3% of the population that has OCD. And it affects men and women the same, and 30% of people have their first signs in their early young childhood.
And then those are sources.
Hey,